Are you thinking about becoming a nurse, but not sure what nursing actually looks like? Well, you're in luck because I asked real nurses for the truth about their nursing careers. So I'm here with Bridget, who is a peds nurse practitioner. Is that right?
Yes. Yeah.
Yeah, cool. And you did do a registered nurse for a bit before becoming a.
Did not.
You did not. Wait,
Oh,
so can
does
you
that
tell me
ruin
how
the
you got
project?
there? Yeah.
Um, no, my undergrad degree is in nutrition,
Mm-hmm.
and I started as a registered dietitian, and
Oh,
I
cool.
was working in a clinic, an outpatient clinic, and saw the job of being a nurse practitioner and knew that that's what I wanted to do. So I went back to school, to grad school, and did a combined BSN, MSN
Oh,
degree. So Penn has a program where they blend the BSN and MSN and you do it all at once. Um, so that's what I did.
cool. How much time did that take for you to do?
So um, because I had all the science classes from my undergrad, the
Mm.
BSN portion, um, was only a year. It's 12 months. And then the master's portion of the program was like 18 months. And I did it all in all, I was at Penn for like 27 months or something like that. Yeah.
Okay, that's not too bad.
No.
Yeah. So how did your like registered dietitian responsibilities, like the level of responsibility change when you became a nurse practitioner?
So a lot of being a nurse practitioner, how it's different from um, just the RN
Mhm.
BSN degree is you really learn a lot of advanced assessment skills. So I'm diagnosing and managing diseases. You learn a lot of pharmacology and you learn a lot of, which medications to prescribe, what are the side effects, and sort of lots more skills on top of the basic assessment skills that nurses learn.
Cool. Yeah. I had a question about how is a nurse practitioner different from like a primary care doctor?
Hmm. So, primary care physicians, whether they're an MD or a DO, go to 4 years of medical school, and then they do pediatricians do a 3-year residency before, so 7 years of training before they're what's called an attending physician, which means, they're done with their training and they're able to do everything within the clinic, sign their own notes, write their own prescriptions, that sort of thing. Um, when you're a primary care nurse practitioner, the rules are a little more variable by state. Um, and the training is obviously different, right? Most people have a 4-year BSN degree and then they go to grad school for 2 to 3 years for a master's or a doctorate, depending on their program. And then, depending on the state, there's different rules around the licensing, but you're done after grad school. So for me, I was done and I took a boards exam after those 2.5 years at Penn. And then you start, and you need a lot of training and support at the beginning. Um, but once you're in clinic, the tasks that you're doing room to room aren't that different.
Oh,
You don't
cool.
really notice. You don't really notice. I always introduce myself as a nurse practitioner. I think it's important for people to know my training,
Hmm.
but the tasks in the room in an outpatient clinic are very similar. There's not much difference in the role.
Yeah.
But that can look different depending on where you work. But where I work, it's very much the same.
Yeah, yeah. So, how does your like day-to-day job look like? in at are you at Penn Hospital
So I'm at
or
Children's Hospital
oh yeah, CHOP.
and I work in the outpatient clinic. So my day to day, if I'm in clinic seeing patients all day, I usually start at 8:45. My first patient's at 8:45, and then the last morning patient's usually around 11:30. And I probably see 10 to 12 people in the morning, and then we have a little time for lunch, um, in which we don't often have time for lunch because we're usually doing our charts and finishing seeing people who came late.
Hmm.
And then we start again at 1, and the last patient's at 4. So I'm usually done by 5 o'clock. So it's a very busy day, but
Hmm.
it's a lot of fun too.
Yeah. And I personally know that you have children. How does this job like interact with that side of your life?
That's a great question. So I think nursing can be a great career for people that want to have kids. A lot of nursing um, schedules. It's nice to have a little more flexibility. Most of the time, if you're an inpatient nurse, you probably work 3 12-hour shifts a week. So you're working 3 days, usually like 7 to 7, or you do that at night. So it
Hmm.
gives you more time and flexibility to do other things or take care of little people
Hmm.
during the day. So that's kind of nice. Um, for me, um, it's a little different because I work, daytime
Hmm.
hours, evening hours. But I think it works well with being a mom.
Yeah. Good to know. Good to know.
Yeah.
Um, so speaking more clinically, like what are like the most challenging, complex cases that you handle
Mm,
without violating any HIPAA, of course?
yeah. Um, so my clinic tends to see a lot of babies that were born prematurely, which
Mm,
come with a lot of long-term complex complications. Some of them might be like cardiac defects. That's the most common birth defect. So a lot of babies that are born early or babies with genetic conditions also have heart conditions that you have to manage. And a lot of premature babies have long-term lung complications or lung conditions. So when they're sick, they get really sick, and they can get sick really quickly. So if you're the first one that sees them, you have to really understand all of the unique conditions they might have and understand them pretty quickly so you can make a decision on how best to help them, whether it's helping them at home or helping them get over to the hospital because they have to go stay at the hospital for a little while. I would
mm,
say that's the kids with medical complexity can be really, you need to put a lot of thinking and attention into taking
mhm.
care of them.
Yeah. How do you deal with the emotional side of seeing like sick kids?
Yeah, that's so. One of my jobs, besides seeing patients, is helping um, lead what's called the well-being program at the
Mm,
hospital. So I do research and look at what we know about how organizations can take care of people while they're at work. And we do know that people that work with really sick kids or chronically ill kids are at higher risk of burnout, but also
mhm,
it can be a really hard job emotionally to take care of sick kids. So I do a lot of taking care of myself. I do a lot of yoga. I like to exercise. I like to be outside. I like to
mhm,
spend time with my kids and my family. So I really make sure I'm doing all of those things so that I can recover a little bit from
mhm.
the hard stuff. Yeah.
Yeah, yeah, yeah. Throughout all these interviews, I hear a lot about how emotionally and physically tolling nursing is, but
Mm.
it seems that all of you have in common is that you love to do it anyway. So,
Yeah. Yeah, it is. I would say inpatient nursing in particular is more physically taxing. I'm on my feet all day. I'm not sitting. It's definitely not a desk job, but
mhm.
I always make sure I'm wearing really comfortable shoes. But I'm not doing like super heavy lifting or like twisting my body in weird positions like a lot of inpatient nurses might have to do. So, yeah,
Yeah.
a little different.
So if there are nurses out there or people who are thinking about being a nurse practitioner, what advice would you give them either for schooling or for the job in general?
So, I would have people think about there's one of the things that I love about nursing careers is there's so many different things you could do. You can work in a hospital, you can work in community settings, you can work in schools, you can. So there's, I would say, after your undergrad, take the time to really learn and try different things. I knew I went right into a program because I knew through my other clinical experience what population I wanted to focus with. So I'm a little bit of a unique case, but I think for
Mhm.
most people, it's a good idea to kind of get some different experiences before you go onto an NP program, if that's what you want to do. The role of an RN and an NP are different worlds. So I think it can be really helpful to have a good clinical base before you go on to NP school.
Yeah, yeah. Are there any like certifications or additional training that you think would be valuable and helpful?
So I have additional trainings in I've sort of evolved them over the years
Hmm.
based on what my patients need. So 1 in 5 kids in the United States also has a mental health condition. So I have additional training in mental health in the primary care. Um, I also have yoga training that I do. So I bring
Hmm.
in lots of complementary stuff into my work. So I am a yoga teacher. I have certifications in acupressure, which is
Ooh.
similar to acupuncture, but in kids, we just use seeds rather than needles. So sometimes I do that. I also have a Reiki certification, which is an energy type of therapy. So I've sort of evolved based on what my
Hmm.
patients need. Um, and I think that's something that any nurse can do is once they sort of understand what they really love, they can continue to grow. That's why they call a lot of nurses when they look at all the letters after their name, they call it alphabet soup because so many of them are learning and looking at different ways to help their patients.
Yeah. Oh, that's really cool.
Yeah.
Like, from what ages do you see, like kids from like, you said newborns
hmm
to,
So I see newborns through um, age 22.
oh, okay.
Office, yeah. Um, I think my license certification stops at 22. So,
Okay.
yeah.
Cool. I think other departments in CHOP are similar,
hmm
from my understanding.
Yeah. Yeah.
Yeah. I only have a couple more questions for you.
Sure.
What are some misconceptions about being a nurse practitioner or like that people have?
I would say some people who haven't worked with a nurse practitioner or don't know the work they do or their training think they might not be getting as good care. But there's lots of research that shows that the care nurse practitioners provide is high quality and patients have sometimes even better outcomes than our physician colleagues. So I think sometimes people think I'm getting the nurse practitioner. It's not as good, but I don't think that's true. I think both groups can give excellent care. Um, a lot of people don't know what a nurse practitioner is. They
Hmm.
might think like you're a nurse or you're an LPN, which is a licensed practical nurse. They're not quite sure what the role does. So sometimes, I if someone's like, "What's that?" I'll usually say, "Oh, I in this office where I work, you'll see a nurse practitioner, a physician, and we do the same job, but our training and how we got to the room is different." So sometimes depending on the patient if, and their familiarity with what an NP is,
Hmm.
kind of have that conversation first
Hmm.
before we started out talking about their kid.
Hmm. Yeah, cool. Um, and my last two question is, over your career, how have you seen like the your career and like the roles of NPs change?
Um, so the NP career is growing for
Hmm.
sure. Um, it is the second fastest growing occupation in the United States, according to the U.S. Bureau of Labor and Statistics and their report from 2023. So NPs are number two and PAs are number seven.
Hmm.
Um, that's something I cite a lot when I'm doing my research work, so about how to
Yeah.
support NPs in organizations. Um, so it's growing, and NPs can do a lot of different things. My job looks very different than an NP who works in the inpatient floors, and their day-to-day looks very different. So I think that's part of what's exciting about it is that you can still do lots of different things. So it's growing, it's expanding with healthcare and economics. There are going to be more and more NPs in hospital systems. So I think that's the biggest change is just um, learning how to grow and identify your unique role and what you bring to your patient is kind of evolving story. So it makes what is an NP really confusing for
Hmm.
patients sometimes, but
Yeah.
I think it's a good thing. I think.
Hmm. And that kind of like feeds right into my last question is
Oh,
like,
good.
what do you hope for the future of NPs or the future for nursing?
So for the future of NPs in Pennsylvania, I
Hmm.
would love to see Pennsylvania pass a law called Full Practice Authority, which means right now I need to have a physician and a backup physician. So it's called a collaborative agreement. I need that for my license. I can't practice independently without it.
Hmm.
And we know that experienced nurse practitioners, the care is good, and there are many states where experienced nurse practitioners can practice independently, so they don't need a physician to collaborate with on their license.
Hmm.
And so it really expands care in underserved areas, which is where I'm passionate about working, but also in rural areas where there's just not enough healthcare providers. So I'd love to see Pennsylvania do that. So that is my hope.
Yeah.
If you have any people at school that are over the age of 18, that vote will be coming.
Hmm.
So
That's
call
gonna
your
be me. Hmm.
legislators. If there are 18-year-olds in the senior class that can
Hmm.
vote, they should be calling their legislator to support full practice authority.
Oh, I will. Yeah, I will
Yeah.
let them know. Well, thank you so much for letting me interview you. This was great. And yeah,
Thanks.
yeah.
Talk
Okay.
to you
Have a
soon.
good rest of your day.
Bye.
Bye.